Hi everyone, this is Dr. Stefan. Welcome back to another video. In this one, just a short comment about why it's important to actually take your inhalers with you to your consultations. Now, if you've been prescribed an inhaler, whatever that inhaler may be, Ventolin, blue inhaler, more complicated modern inhaler, it's really important to know that you're using it correctly. Now, I have a few videos on the channel where you can see inhaler technique for various inhalers or the main types of inhalers. There are other videos out there that are very well made from associations of doctors and things like that. So you will find information out there, videos, clips, pictures on how to use the inhaler, but nothing beats actually having another human being who knows what they're doing, giving you direct feedback on whether your technique is correct or not. So what we tend to encourage patients generally is that they bring their inhalers to consultations. When they do that, we can actually just have a little bit of a discussion. Are you comfortable in using the inhaler? Is there anything you could improve? Are you rinsing your mouth after you're taking a steroid inhaler? Things like that we need to review every now and then because we need to reinforce these messages. It's very easy to forget, to get distracted by other things that are going on in life and to forget how to use the inhalers correctly. So I'd really, really recommend that if you are suffering with a lung disorder, an airways condition, and you've been prescribed inhalers, every time you go for a follow-up consultation with your doctor or your nurse or another healthcare provider, that you bring the inhaler with you and you have a brief 5-minute conversation about whether you're using it correctly. Because with these type of medications, if you are using them correctly, you may get a lot of benefit because I said this many times, they have very few side effects because the dose of medication that is inhaled is very small and it's inhaled right in the airways where it needs to act. But at the same time, if you're not using them correctly, you're not getting that benefit or not the optimal benefit, and you might then get more side effects from inhalers, which is to do with the inhaler technique. So just using them correctly, having that conversation is really important. It's a medical device at the end of the day. So using the inhaler properly will ensure that you're getting optimal results for your treatment, and your doctor will also know whether they need to up your medication or not. Because sometimes, maybe in the case of someone who has asthma, they're not using their inhalers correctly. The doctor may feel tempted to put you on very strong medication because your asthma is not controlled, but it may not be to do with the inhaler not being effective, but not being used in the optimal way. And this can happen to a lot of people. Really, really. It's very hard to use these at first, especially if you haven't had the right coaching at the beginning. So just going back to every consultation with your inhaler, taking an extra dose then and there, it's probably very helpful. And it's not something that's considered dangerous. If you take an extra dose of medication, you'll probably be fine if you just use another puff in front of your doctor just to see how you are doing and to get some direct feedback. I think that's really, really important. Just a short comment. I'm going back through my old comments. This was just because someone was actually saying thank you for putting up the videos on how to use inhalers. And I understand it's very easy when you see something to do it better. But yeah, I'll go back through my previous comments on the channel. I have a bit more time, maybe in the next few months, to go back and answer some more of your queries in future videos. Thank you for watching. All the best and good health.